Hi, Dr. Lonnie Herman here, and I am with you right now to share results and new exam findings for a patient who's had neuropathy. So if you've got neuropathy or know somebody who has neuropathy, first thing, click on the subscribe on my YouTube channel because I share videos all the time of great, useful information, as well as share this video with just one friend who you know is dealing with neuropathy, whether it's caused by diabetes or something that the doctors haven't figured out yet. And if you've got some other kind of health concern, listen to what I'm about to share with you because I'm certain that it's very unique in the way that, not only the way I describe it, but my findings, the content here, that will help you understand maybe about your health condition that you're looking for answers for. This gentleman comes to me in my clinic, came one time actually to my clinic in South Florida. He's from Canada, he's in his 30s, and he has been dealing with a neuropathy condition in the hands and the feet. And down part of a leg for some time, and in our first visit his body was only ready for some intestinal stress, repair infections in the intestines and the lymph, and after his, which I made a video on him before, so I'm just rehashing in this video a few of these findings. He had infection in the intestine and the lymph, and I was able to see or consult with him again long distance within just a few weeks, and he had experienced no change in his sensations with his hands or his feet or his legs. So in the last round of workup with him, I had found that in the capillary beds, which are blood vessels that help you carry blood between your arteries and your veins, delivering oxygen and nutrients to those blood vessels and to various tissues in your body. Your arteries are the blood vessels which bring blood to your nerves. So, and like needle pointing a thread through a needlepoint grid, that is exactly how the artery feeds the nerve. Nothing else in your life from womb to tomb can pierce a nerve without damaging that nerve instantly. The only thing that can pierce a nerve without killing it but do the opposite by giving it life is an artery. So the capillaries were really important for him because the capillaries are blood vessels that help to transfer blood between the arteries and the veins. And in this case, on the last exam, which was May 12th of 2015, his more recent exam is June 16th of 2015, his capillaries had vaccinations, they had mold and fungus and Lyme, Borrelia burgdorferi, Lyme infection, it had the Babesia parasitic infection, it had antibiotic residues in there. And further down the line in his examination, which I made remedies of these exact specific samples of these infections and make copies of them so he could take a drop. And the understanding in this type of causative homeopathy work is that like cures like. So take a remedy as a drop of the exact specific potency of that infection, and it's going to just work at that infection in that specific tissue as it did for him. The second part of his his last exam in May was about the frontal lobe of his brain, which is the whole front half of the brain. There's a right frontal lobe and a left frontal lobe. And the frontal lobe helps you to send blood flow to different parts of your body, organs and systems, nerves and all different tissues. And his frontal lobe was infected with viruses, multiple viruses, with a Lyme infection. And he had to follow specific protocols on different days to be able to knock, as best as he could, knock the Lyme and the viruses out of the frontal lobe. Now, with my work, I'm able to go back to that tissue on the follow-up exam, which I'll get to in just a minute. And I'm able to find in that follow-up exam, are those tissues, in this case, let's say the frontal lobe and the capillaries, are they still infected? Are they still toxic? So with this unique system that I follow with a bioresonance testing, and if you look up bioresonance online, you're going to see electrical devices that people use to try to study the body. And I find fault with those, but we're not going to get into that right now. We can talk about that in private or in another video that I'll put up here on YouTube or Facebook. But understand that the electrical devices, I'll give you the short of a long story, is that the electrical devices with bioresonance testing actually can put electromagnetic stresses from the electrical device into the body, and then the body will produce scattered information and not as reliable and not as perfect, because when the electrical smog gets into the body, you could look up these terms: dirty electricity, electromagnetic field stresses, and electrical smog. When that gets into the body, there's scattered electrical impulses that go on through our body that can override and impede the reading of different organs and tissues with a better non-electrical bioresonance type of testing that I use in my practice. Now, he's following the protocol with the capillaries and other nerve tissue extract supplement that help to give food, so to speak, to the nerve tissue to help it regain its function. Here is what he shared with me 3 weeks after he started following the May protocol. So I spoke with him again June 15th of 2015. He told me that the right calf regained sensation. He told me that he had been going to medical neurologists for a while and having different tests, which all had given him the answer that after they ran a sharp object, a sharp pinwheel testing instrument down the right calf, and he said that I feel that, and they said, well, you have nothing wrong with the nerve. And he said, no, but there's something that's strange inside my leg. I feel like I can't even, something is just not right. And they said, but you're normal. You come up normal to that test. Well, that's not right. Okay. There were other tests done for this gentleman, but with one of his complaints is that he couldn't feel when he was flexing, when he was making a muscle in the calf. He couldn't tell. He told me in this follow-up exam consultation period that he finally can feel, he regains a sensation in the right calf. He said, I can feel when I'm flexing my calf. I feel a change, which is awesome, because having no feeling, no ability to sense that something is going on in that calf when you're making a muscle is a very troubling feeling. I mean, he was losing his balance. He didn't feel stable on the floor, like others who have neuropathy in the legs or the feet. And he also said that August of 2013 was the first of many symptoms where he noticed also that his hands were not sensing things the same. He told me in this round, in this consultation, his right hand regained sensation between 40 to 50% improvement in the right hand. So that's phenomenal. He said that his feet still feel numb, yet they feel better now with the treatment. And he also said that his balance is much less problematic than what it was. Well, these are all great findings. We're moving in the right direction. He's not completely relieved of the whole symptomatology of his neuropathy, but we are moving in the right direction. In this follow-up exam, I retested, as I told you in his last exam, about the capillaries and the frontal lobe. They still are showing stress, but they weren't the primary tissues that needed help this time around. This time around, the primary tissue was his artery. His arteries turned out to be number one. Remember I told you before, the arteries feed blood to the nerves, not the veins, not the capillaries directly, even though the capillaries are a bridge. If a bridge gets congested and the blood is trying to go from one area to another and there's congestion on that bridge, the capillary, it's going to be a bit difficult to get the blood nutrients and oxygen over to a tissue, an organ, a nerve, part of the brain, or a bone marrow. So what showed up with his artery are multiple metals, heavy metals, multiple vaccine residues and side effects of those vaccines in the artery, the Lyme Borrelia burgdorferi bacteria in his artery, Bartonella in a very high level, the Bartonella henselae infection, commonly found with Lyme infection. It's known as one of Lyme's co-infections. Sometimes some people say the Bartonella is worse than the Lyme infection. Others say it's not as bad. Regardless, it's there. It's an opponent. It's an aggravator. It's a stressor. It's an invader that needs to be removed from the tissue. And in this case, the Bartonella was a very high potency that we had to use to get that bug out of the artery. Multiple fungus strains in the artery. Candida glabrata in the artery. Candida can be very harmful. It can carry in the bloodstream, it can carry mercury along with it and just totally inflame and aggravate and annoy the tissues. We found mycoplasma bacteria in his artery. Now just think, when you've got infections like this in the artery, like this mycoplasma bacteria and the Lyme and the Borrelia and all these others so far that I've said, well, besides the last finding in the artery was mold and fungus. He has multiple mold and fungus strains in there as well. Maybe from peanuts, maybe from fruit, somewhere along the line he's picked this up. When you have these infections and toxins in the artery, do you think that the artery is going to be inflamed? Do you think it's going to be aggravated? I mean, if you get a mosquito bite on your arm, do you think you're going to get a swollen area, a swollen patch of skin, and even the tissue below the skin gets swollen because of that mosquito bite? Right? So just imagine having 1, 2, 3, 4, 5, 6, 7 or so infections along with toxins that are like mosquitoes biting the artery beds. What do you think is going to happen to the artery? Is it going to function normally? No. Is it going to be aggravated? Is it going to be swollen? Is it going to possibly cause less than normal blood flow to the nerve? Is it going to possibly cause inflammation throughout the artery, which can also inflame and cause less than normal function of the nerve? Is this making sense to you? So we made remedies to go after those tissues, to go after those infections in that tissue, as well as help to boost the function of his artery. Now, further along in the examination, I found that the capillary that was treated before in the last exam still had a Borrelia burgdorferi infection at a much less level, but it was still there, and we're going after that in this round, as well as he's got still problems with the frontal lobe of the brain. So in this round, it's not about fighting an infection or toxin in the frontal lobe, it's just weak function. And the frontal lobe, again, helps you to pump the blood. The right frontal lobe, you've heard left brain, right body, right brain, left body. Well, the right frontal brain controls the blood flow down the right side of the body. The left frontal brain controls the blood flow down the left side of the body. In this round, we're giving him boosting remedies to help pick up the function. It's like boosting. You can go and jumpstart a car's battery that's dead with jumper cables to one battery and send the signal, the electrical signal from that battery over to this one. Well, I can actually take a sample of frontal lobe brain frequencies at optimal function and make a copy out of that and give somebody a remedy that will give that frontal lobe a boost in function, like jump-starting a battery. It's the same thing. We're dealing with frequencies. We're dealing with what Albert Einstein once said is, all matter is energy. All energy, which I'm saying now, there's frequencies. If all matter is energy and everything is physics, we've got to look at the body in a different way. Okay? So he's getting particulars for the arteries, the capillaries, the frontal lobe. And I look forward to his next exam, his next consultation, which will be over a month away from now when he finally starts these. I have to ship his products up to Canada. And when he takes these, and I'll follow up with him again and see in that month's period of time, which it'll be actually a little more than a month, but we'll see at that period of time, what other improvements, what's better, what's the same, what might have gotten worse. Sometimes there are certain tissues that also need help that didn't take precedence in their understanding of their body because the feet are so numb and that's number one to them. Sometimes there are other issues that go on, and sometimes, as good as I can be, sometimes there are other tissues that also needed some support. And as diligent as I am with the person's exam, sometimes there might be a tissue that needs support that might be overlooked. But I do my best job in the moment to help an individual. I'm going to just share with you. This was for neuropathy. There are many other videos here where you're going to notice as you listen to my information, there are many different conditions that have very similar findings of similar kinds of infections, similar kinds of toxins. It's not all just dealing with neuropathy. You can find these infections and toxins in autism. You could find them in cancer. You could find them in heart disease. You could find them in bone disease. You can find them in intestinal disorders, and you can find them in thyroid disease and diabetes and rheumatoid arthritis. The list goes on. Okay, so any kind of inflammatory condition causing a malfunction, they seem to typically have the similar or the same exact findings, even in the same tissues as another person's condition. So I just want to thank you for coming into this video and watching this, and hopefully, yes, you are sharing this with a friend and clicking the subscribe button on my YouTube channel. You can call for an appointment in my clinic. The number is 954-370-3100, and I look forward to helping you and or a loved one. Thanks again.